start this webinar, thanking Governor McGreevey, Reverend Bolivar Flores, and the psychiatric expert from the New Jersey Reentry Corporation for the unconditional support in providing services and resources to empower our school community and local community in Union City with the resources that they need and deserve. Also, I would like to thank Silvia Abbato, Superintendent of Schools, for always supporting events that help to educate our school community about health and well-being. Now, it is my pleasure to introduce my friend, Governor Jim McGreevey, former governor of the state of New Jersey and chairman of the New Jersey Reentry Corporation, who will serve as the moderator for this webinar. Welcome, Governor McGreevey.
Thank you, Mercedes. Thank you, my friend, and thank you all for all that you do for Union City, the school district. And as many people know, the Union City School District was featured on National Public Radio as one of the most successful school districts in the nation. It's a largely Latino population whose reading scores and mathematical proficiency has outpaced statewide averages, and that doesn't happen by accident. So I just want to thank Mercedes, I want to thank the superintendent, and I also want to thank our mayor, Mayor Stack, for what he did in the state Senate for requiring that mental health services be provided during the course of the public health emergency. And with us for some quick introductions, we'll have Lisa. Lisa, who are you?
Hi, everyone. I'm the Senior Director for Addiction Services at Bergen Newbridge Medical Center.
And what does that mean?
What that means is, so we have a very large detox. We also have 2 inpatient adult units. One is a primary substance abuse focus with 20 beds, and the other one is a co-occurring 20-bed unit, as well as a very large outpatient, intensive outpatient program for adults and for adolescents. And
so you're a provider for treatment for adolescents and adults.
Adolescents and adults, correct.
Okay, great, Lisa. And thank you for your partnership with all of us, and thank you for working. Ralph Pisanti, what do you do, and why do you have the map of Italy behind you? No, I'm only kidding.
I have the map of Italy behind me because it's my father's, and he insisted that we always know where we were from.
Good. And Ralph, can you share where you're from? What do you do with the district?
Absolutely, Governor. Thank you. I am the coordinator of data and community engagement at the Board of Education. I work with the superintendent directly on reaching out to our community, our parents, our students, and the city. And I also run the social media for the district.
Thank you. Thanks, Ralph. And Rob, can you introduce yourself?
Yes, sir. Robert Carter, I'm the Director of Operations and the Director of Addiction Services for the New Jersey Reentry Corporation.
And what does that mean in terms of addiction services for New Jersey Reentry?
So at NJRC, we're able to place people into treatment, whether it be detox, residential, outpatient, medically assisted treatment within 24 hours. So, whether it be in person or even remotely from the site, we're able to get them into treatment or have them see a doctor and have them get a prescription for medically assisted treatment if that's what they need.
Sure. And our special guest is tremendous. I mean, it's just, I feel my IQ level rises precipitously being in proximity on the Zoom, but Dr. Levounis is chair of psychiatry at Rutgers Medical School. He previously studied at Stanford. He did tenure at Columbia Institute of Addiction. Like, he's a big mahaf. So Doc, can you just share with us, and I want to go back to what Mercedes said in the introduction. This has been a really difficult time. And it's also been a difficult time for those within the immigrant community that are grappling with all of the tensions that are ordinary in life, but in addition to that, language barrier, cultural barrier. So in terms of, what did you describe it as, Mercedes, sufriendo de nervos? What was the phrase? When you suffer of nerves, manifestation of anxieties. and just talking about nerve suffering. She had a great expression in Spanish. But what is it when anxiety and depression during the time of COVID, what triggers that anxiety and depression? And is it worse within immigrant communities?
First of all, thank you so much, Governor, for inviting me to this webinar. And I think you are the president of my fan club. With the things that you say about me, half of them not true, but thank you very much, and I appreciate it, and I'm honored. When under periods of stress, and obviously a traumatic event like a pandemic is a major stressful event, tends to bring the best out of people, but also the worst out of people. So we tend to polarize to get more to the extreme. So we do see amazing acts of heroism, of self-sacrifice, but at the same time, we do see more discrimination, we see more hatred, we see more the things that are the dark side of our humanity.
Why does that happen?
Because under stressful situations, we lose the grace of life. We try to see, we see things as black and white. In some ways, we regress to an earlier stage of development, if you want to talk Freudianly a bit. And we go on battle stations. So we have to combat this very stressful situation, whether it's a pandemic or Superstorm Sandy or whatever the disaster may be. And we don't have time, we don't have mental energy really to work in a more nuanced, more, this, but also that, and more complex life. We just like simplicity, and it's all good or all bad, and we just go to our battle stations at the extremes of our humanity.
And does it impact children differently than it does adolescents, or adults?
As you very well know, Jim, I'm not a child and adolescent psychiatrist.
No, I know, yeah.
But a lot of things that we see in adults show up in children in a different way. We see much more irritability when in an adult we would see depression. We do see more rebellious kind of attitude, where in adults we would see more anxiety. So everything seems to be a little more outwardly driven than perhaps in adulthood.
And what is the connection between depression, anxiety, and addiction? Is there a connection?
The more we study depression and anxiety, the more we kind of consider them to be more similar than different. If you think about...
I'm sorry, Doc, could you explain to me, and this is hopefully, I know it's helpful to me, hopefully to audience, what is anxiety and what is depression?
In the simplest form, but a quite accurate one, I would say that depression is a preoccupation about the past, while anxiety is preoccupation about the future. When you're depressed, you keep on ruminating about things that you feel guilty about, or you could have done differently.
I never heard anybody explain it so simply before. So, so depression is a preoccupation about the past, and anxiety is a preoccupation about the future.
Correct.
Go ahead. I just wanted to re-say that, because I think that's a wonderfully straightforward definition.
Yeah. But the underlying engine of both is a preoccupation. They seem to run through similar receptor mechanisms in our head, primarily serotonin. They seem to be responding to similar treatments, whether they are psychotherapy treatments, talk therapy, or whether they are medications like the antidepressant medications that we have. So there are a lot of similarities between the two. Now, the second question that you asked is, what is the relationship between this depression and anxiety and addiction? But go ahead, you seem like you want to ask something else. I think you're muted, Jim. Jim, you're muted, at least to me. I cannot hear you, Jim. I don't know what happened. I could hear you just fine, and then I haven't been able to hear you for the past few seconds. What about the other people? Can you hear Jim?
No.
No,
Okay.
no, he's
No, we
muted.
cannot hear him.
It's showing as muted, Governor. Try unmuting the box.
Oh, thank you.
There you
Okay.
go.
Okay.
It's those complicated gestures like mute, unmute that trip me up every time. It's Ralph. But anyway,
That was
I'm
playback for the
I'm
Italy map.
I have anxiety about mute. So what, can I go back to asking Dr. Levounis about, we talked anxiety and,
I cannot call you Jim, and you have to call me Petros. Yeah, that's
okay, Petros.
Yeah, otherwise you have to call you Governor McGreevey.
Okay, can you connect me to addiction? So you have anxiety, you have depression, and where is addiction as a, I don't know if this is the proper term, and I'm stepping outside of my lane. Where's addiction as a coping mechanism to address either of those two?
The way to think about the relationship between mental illness, whether it's depression or anxiety, and addiction is along a spectrum, kind of a continuum, if you like. On one end, we have depression and anxiety as a consequence of addiction. You use alcohol chronically, and one of the very, very well described consequences of your alcohol use may very well be depression and anxiety. And on the other end of the spectrum, we have pretty much the opposite. We have depression and anxiety fueling addiction, that you are depressed, you're anxious, and then you self-medicate these conditions with drugs of abuse. But then, if these are the bookends of this continuum, of the spectrum, you have all the variants in between, where we have a very complex interplay between mental illness and addiction, where they feed on each other, and sometimes it is the anxiety and depression that results in the addiction, and sometimes the other way around. The good news here is that the treatments that we have pretty much address the entire spectrum in between these two and the bookends that I just described. In the past, we used to be very adamant about which one came first. Is it the depression that came before the addiction, or the addiction before the depression? Because we did have kind of similar, different treatments, while in 2021, life is a little easier from a treatment perspective.
So that you can treat cooperatively both of them concurrently.
Correct.
So, and then we're going to jump to Dr. Shah, who's joined with us. So if you have anxiety, you have depression, you have addiction, in the time of COVID in terms of mental health, how do we, or is it possible to break those triggering mechanisms? And if so, what does that look like?
I think that the idea of what came first and what's the real core cause of my problem has captured people's imagination.
Yep.
And it's not quite as helpful.
It's not quite as helpful.
Not quite as helpful. Somehow people live with a fantasy that if only we were smart enough as providers, or they were smart enough to go in and unpack the real problem, the very core of the issue, lance the boil, as Freud would say, express the past, relieve the pressure, then boom, they wouldn't be depressed, they wouldn't need the cocaine, they wouldn't need the alcohol, they would be just fine. And that is not exactly true. So I try to help people move away from this preoccupation about what came first, what is the true origin of all these problems, because we have to address all of them. It's not enough to just address whatever original trauma may be there. You have to address the real life today problem with alcohol. It's not enough to address the alcohol. You have to also address the depression. And in that
it's fascinating
way, I don't think it's all that helpful to hunt for the one and only original problem.
That's fascinating. So that you don't see it as an ordered development, and if you do, not what difference does it make, but it's not determinative in terms of treatment.
Back to that continuum that I described before. If you are absolutely convinced that all your depression is due to your alcoholism, it is reasonable to throw all your efforts at treating that alcoholism and then have a reasonable expectation that your depression will improve. Similarly, if you're absolutely convinced that all your alcoholism is due to your depression, it is reasonable to throw all your efforts at treating the depression and have a reasonable chance that your alcoholism will improve. But this is only true for the really extreme situations where there's tremendous clarity about what is going on. The majority of life, as you very well know, is much messier than that. And so you cannot get away with single treatment. You have to really address both.
And you said something when Mercedes was just starting the call, which I thought was interesting, is that the incidence of substance abuse hasn't necessarily been triggered by COVID in just the general population. It's been seen among the population which has historically had a pattern of substance abuse. Did I phrase it?
People who suffer from the more severe form of the illness have had it very, very badly during the pandemic. People who suffer from severe alcohol use disorder, for severe opioid use disorder, we've seen an increase in relapse, we've seen overdoses, we see deterioration of the illness, all kinds of bad things. People who may have the lighter forms of the illness, let's say a social drinker, somebody who just goes out and has a few too many every once in a while. First of all, the bars are closed. So there's not that much of that social
interaction
use going on. And we don't see that many new onset severe cases of drug and alcohol use disorders. That is consistent with previous studies with 9/11, with the very famous Oklahoma City bombing studies that Carol North did some years ago and followed it very, very closely, which is particularly interesting to me. And
thank you. Aakash, so Aakash, could you just share with us, and you're on mute, so you won't make the same mistake I did. So so during COVID, you've obviously seen an increase in anxiety among our program participants, among people in the hospital at Hackensack Meridian, haven't you? Or maybe you haven't.
Absolutely. And I don't have to think too far back at all, because I was working in the emergency room late last night, and one of the last patients I had was someone who had a history of opioid use disorder, had made immense progress towards recovery, and had been in recovery for several years. Just an incredible individual with an incredible story. And what had done it for him was in part medications, in part counseling, and in part the ability to go to the gym, right? He was a 280-pound bodybuilder, and he was very clear that the ability to go to the gym and exercise once, if not twice a day, was how he maintained his recovery. And then the pandemic happened, and the gyms closed, and then things got stressful at home, and then things got stressful at work, and then he returned to use. And I think that's a part of the journey, unfortunately, in the same way that a diabetic might end up having a sugar-filled meal, and someone with high blood pressure might end up having a salt-filled meal. Someone with a history of a substance use disorder may return to use. But I think what was at the heart of our conversation last night was, okay, so you've returned to use. Let's figure out a way to pull you closer instead of push you away in this time of need, in the same way that I would for a loved one with diabetes whose blood sugar crept too high. Or
so was it that his pattern was disrupted? That's
exactly right. Yeah. He
so
just simply couldn't go to the gym.
It's as much, if you will, Aakash, about his healthy patterns being disrupted as the trigger for the substance?
I think so. And I think it goes back to a phrase that you're fond of, the rituals, the rhythms, the routines that allow us all to live a meaningful life. And for this individual, that ritual, that rhythm, that routine was going to the gym once, if not twice a day. And when that got disrupted, it threw his life into a tailspin in much the same way that if our own routines were disrupted, it may very well send our own lives into a tailspin.
So Rob, you've seen that with our program participants. I mean, their lives have been disrupted, whether it's AA, whether it's NA, whether it's life, whether it's school, whether it's work, and what's been the response?
Just to echo what Dr. Aakash said, it's 100% that the disruption in the day-to-day, simplicity that they finally found in life. Life is so complicated when you use. Your entire day is chaos from the second you wake up to the second you pass out. Man, we didn't go to sleep. We eventually passed out from exhaustion or whatever. It's just nonstop chaos. And it's just a simplicity that being clean and recovery brings to your life, and you find that, and you become addicted to that. You can become addicted to that simple lifestyle. And once that's
a healthy addiction, some would argue.
Yeah, no, 100% healthy. You get up, like you said, go to the gym, go to work, go to a meeting, do whatever it is that you do that makes your life simple and relaxing and enjoyable. All of a sudden,
in the interest of full disclosure, Rob gets up at what time in the morning and runs how many miles?
4:36 miles in the morning.
He gets up at 4:30 in the morning and runs 6 miles. Right. So I don't have those problems, but anyway.
But it's so true. If there was a day that I wouldn't be able to do that, I don't remember the last time. Literally, I don't remember the last time I didn't get up and run. I wouldn't know what to do if I wasn't able to do that. And the lack of in-person meetings and the accountability and the human contact. There's so much that goes along with that life that people become accustomed to and addicted to, and they enjoy it. Once that's all taken away at the same exact time, I mean, I'm not, recovering addicts or reentry clients, we're not fragile people, but we are. When we get to a certain point in our life where we finally found some type of normalcy, one thing can disrupt it. So you remove 2 or 3 of the most important things, it's really, really difficult to get through something like that, in a healthy way and cope with it in a healthy way. I hear about it I heard about it today. I was talking to my sponsor today, and another guy that he's in recovery. He's one of us. He's a reentry individual, and he's been drinking, and there's no in-person meeting. So nobody really knows. So we found out from his wife, he's like family. He and I got clean a week apart. It's almost 15 years. And work and no gym and all this other stuff, and there's no accountability at the meetings to see him, so he hasn't even come clean with us yet. So how to handle that, it's just
So if to pick up on Rob's metaphor, Doctor, start with Petros. If Rob has created a healthy wall of patterns, of a ritual of running in the morning, God forbid at 4:30, a ritual of working out, ritual of, whether it's prayer or meditation or what you eat or work or the rhythms of how you raise your children, and that block gets removed, does the entire wall necessarily have to come down? Petros.
The way that, first of all, I couldn't agree more about these routines and rhythms that are so essential for our wellness. We very often think about the 4 pillars of physical wellness: diet, exercise, sex, and sleep. And we very much want to add a 5th one, which has to do with these routines that are just so essential.
So diet, exercise, sex, sleep, and
the routines. The routines of life. The routines of life.
The diet, sex, exercise, sleep, and routines.
Yeah. And the way that I advise my patients is to, if a routine has been dismantled for one reason or another, the pandemic is one reason, other reasons, divorces, and injury and all kinds of other things may disrupt our routines. Try to find what are the essential elements of that routine. What was the most pleasurable part, let's say, of running for somebody who's a runner? And maybe the exhilaration of the adrenaline for having a high heart rate, but it also could have been the route that the person somebody could have been taking by the river or by some kind of park or some greenery. And if that is the essential element there, even if you have an injury that prevents you from running the marathon that you used to run, at least you can take these walks and have some benefit out of them. So try to break down those routines and preserve some of the items that can still be preserved and then build on that, of course, and create new routines that are amenable to the situation that you find yourself in.
So trying to create replacement
Yes.
to those bricks in order to hold up and support those routines. Lisa, can I jump to you, Lisa, in terms of what you've done in terms of inducing people for MAT? Just how have you been able, one, just as a process question, make sure that people continue to have access to MAT, and how do you induce MAT in a Zoom world?
So, okay, so I would say that this is something that was amazing to kind of live through in a sense, because I think, you know, a lot of places really just kind of froze for a moment, if you will. And luckily we did not freeze with a lot of help, you know, from our Chief Clinical Officer of Addictions and, you know, the other administration. So by allowing us to stay open and provide that care was really essential, because you know, isolation, lack of connectedness with addiction is really, you know, something to look out for. So by being able to have patients come in person for MAT and just overall treatment, like our intensive outpatient program, kept that type of, you know, physical and emotional type of connection that people really crave.
No, I was up there during the course of the public health emergency, and it was amazing that you were open, that you were welcoming people, and that I just wanted to make sure that everybody in Union City and everybody in the Union City School District understands they can contact Rob Carter, Dr. Shah, and we can get people into treatment literally within 24 hours.
Yeah.
So I just wanted there's a real practical element, not only understanding anxiety, depression, and addiction, and the wall of rhythm and ritual to keep our lives healthy. But if you need that assistance, we're there, Union City, 24 hours.
100%. And Union City, I worked with the Union City very closely prior to Bergen, Newbridge. So Union City, the teens, we have a Teen Thrive program. We also stayed open the entire time. We do telehealth as well as in person. So we're ready for you literally right now. You can easily contact us. I can give all the phone numbers that need be, or like put it on a link for anyone to have that. In addition, MAT, anything that you need, if you want to contact Rob, or again, we can put a list of phone numbers on.
Sure, yeah, no, we'll just with Mercedes to Rob Carter and we'll do it. But I just wanted to jump back. So one, thank you, Lisa, for Newbridge sort of filling a big, frankly, a void for people struggling with addiction, people struggling with MAT, people struggling to get secure MAT, particularly if they didn't have ID, if they didn't have Medicaid, and they didn't have a script or didn't have a way to reimburse. But I also want to ask Aakash, so if I'm in Union City and I'm a family and I'm a father or mother and I have 3 kids and I'm struggling, both financially because maybe I've lost my job or my hours have been cut back, how do I, in this world, to go to what Rob said, to go to what you said, to go to what Petros said, how do I sort of keep it together? And what should I be thinking about? And what should I be reading? And what should I be practicing?
So I would actually, I'd love to get Petros's answer to this as well. Happy to share mine.
This is what happens when you have these doctors. They defer to this one and that one.
Yeah.
They're worse than lawyers.
So,
no.
Well,
Yeah.
when the questions are as easy as the one you just posed, yeah.
Yeah.
Exactly.
So, yeah, no, but I think it is, you know, I am always struck by the degree to which folks know themselves best. And so folks know what are the rituals and rhythms and routines that have worked to them. So I think to lean on the advice that Petros had shared earlier, find how you could, if not pursue it entirely, replicate the elements of it in your day-to-day life. And so for Rob, that may be running. For me, it may be sitting down and writing a memo, whatever it may be, finding ways to continue to do that, and to remind yourself that you're not alone and that the situation that you're going through is not permanent.
How about, so Aakash, how about the what I see, with our program participants and with Mercedes and listening and talking, I also find that this is really this is uninformed, but what I find is that there's a strange sense of boredom, not boredom. There's a strange sense of, you talk about routine, but there's not any of the passion in life because you don't have the human interaction, you don't have the dynamism, you don't have, whether it's love, whether it's anger, there seems to be a flatness. Does that make sense?
It does. Yep.
And that doesn't evoke Dr. Levounis talked about serotonin. I mean, it's just, there's not the richness. So, I mean, you have a decline of those rhythms, what Rob does in the morning at 4:30. You go into work and there you have this little crazy equilibrium, but you're not seeing grandma on Sunday for the 4:30 Sunday meal. You're not interacting with the teacher. You're not, like the richness of life has been dampened. Does that?
It does. And I know Petros was about to jump in. So yeah.
That makes so much sense to me. That's beautifully put, Jim, in terms of some kind of like the basketball has lost a little bit of air somehow, and it doesn't bounce back the way that it used to before. One of absolutely fascinating studies that came out a couple of weeks ago contrasted the mental health of the general public with healthcare providers. And in all kinds of ways, healthcare providers have been hit very hard in terms of post-traumatic stress symptoms, in terms of anxiety and so on. And yet, healthcare providers in overall mental health are faring much, much better than the general public, which is really a conundrum. It's a big question for us. And I think it has to do with the routines, very much like what Lisa said, that it used to go every day to work with a sense of purpose, of doing something that is really amazing for our fellow human beings, with a sense of not being bored, that you're doing something that is interesting. And that all perhaps has translated into better mental health, despite the horrors and terrors that frontline healthcare providers have experienced.
So that people who are in the mental health business have maintained their health.
This is general health, not just mental health.
Oh, they maintain their general health in part because
people, healthcare providers
Yeah.
have maintained a better mental health than the general public.
Sure. So Ralph, when you talk about making publicity and delivering this message, would it be possible to provide not only Newbridge, but what Rob does to sort of make the community aware of this?
Absolutely. We're happy to post whatever resources that we have. Speaking from a personal perspective, as you know, Governor, I'm a person in recovery myself. And I agree with everything. I just want to say everything that everyone said here hit home, really hit home, because this past year has been a real challenge. So any resources that you have, we're happy to share with the community. We'll put them up on our social media pages. We'll put them up on our website. And
we'll put them up hopefully in Spanish and English.
Yes, we always put everything up in Spanish and English. We make sure that our community can understand. Yes, absolutely.
Good. So I just wanted to go back to Aakash and Petros, so that if for the family that's at home that tries to preserve those rituals, those traditions, what should they do? So, your point, Aakash, is that they know themselves best, that they continue those rituals. But is there a resource that you would recommend for people like myself, for ordinary folks to look at, just to be able to reflect and to be better aware of how to be your best doing this? I mean, is it WebMD? Is there, I'm not asking for a specific referral, but is there an opportunity, is there a place that people should look at? And then I just also wanted to touch a little bit about the grieving process and how that's complicated people's emotional health. So is there a place that you look at, Aakash? Is there a website you go to? Is there a book?
Yeah, this is much more personal than clinical. I think what I have found most helpful has not been a clinical resource per se, but the ability to listen to the stories of others who are enduring this as well. You know, because I feel all too often you'll come across folks who are saying, boy, you've got to use this time in quarantine productively. You've got to pick up a new language or a new skill or a new hobby. And the reality is that quarantine, I think for many of us, myself included, is just an extraordinarily difficult time. And so the ability for me to have been able to go online and read the profiles of others who have said, you know what, I'm not learning a new language or picking up a new hobby or developing a new skill. I'm struggling. And I think I've found some solace and solidarity in knowing that the vast majority of folks are wrestling with the same sort of day-to-day struggles as this is. And it helps remind me that this is not just a collective sort of process we're navigating, but a temporary one that will get better. I know that's not quite the answer to your question about a clinical resource.
It's informative. Is that Sunday for Mother's Day, I was at Holy Name Cemetery putting flowers on my mother's grave, and for whatever reason, I looked at, there's an article about florists, interviewing florists, what they went through during the course of the pandemic, how many, like, it was interesting, but it was a little, but they were literally helping people write the notes on the floral bouquets. People were so spent emotionally, they couldn't be at the graveside, they couldn't be in the church, they couldn't be sitting Shiva, they couldn't be doing whatever their traditions were, they couldn't participate. And it was just interesting, these florists were just sharing their vignettes of their trying to be supportive of the stories. So I just would ask Petros, during this time of COVID, grief, and does grief uniquely impact mental health, depression, and anxiety?
Yes, it's a very active area of debate in psychiatric circles because we don't want to pathologize. We don't want to make an illness out of everyday
Life,
human event. So, but then again, you lose a very loved one. You lose your daughter. You lose your spouse, and then 2 months later, and you are losing weight, and you are not able to sleep, and you cannot able to get out of home. You absolutely need to see a specialist. You need to see a psychiatrist. You need to get some help. May very well need to be on medication. You need to address it. So the fact that it's something that is a reasonable response to an extraordinary event does not mean that you don't need some professional help to survive this incredibly painful and catastrophic event that happened to you.
So you shouldn't be afraid to ask.
Absolutely, and it's just that, again, the fact that it is reasonable to have the response that you have does not make it okay. You still need help.
Yeah. And so, Rob, do you think that people that we work with know enough that they need help when they need help?
No, it's all part of the process. You know, I mean, even now with almost 15 years clean, sometimes I don't know when I need help. Like, forget about, you know, just coming home from prison or incarceration or just getting clean. You know, and then even knowing and then having the strength or the willingness to ask for it, and then accepting it, which is in a whole nother process in and of itself. You know, so, you know, we can only, what we do, you know, what we do at the sites is, you know, we identify the individuals that are in the particular situations and we offer that help. We give them the opportunity, you know, any help we can provide, and then we provide services for them to go and seek out the help themselves if that's what's more comfortable for them. You know, some people, they don't want to accept the help on the spot, but, you know, they'll feel a little bit better about themselves if they go and they get it on their own, you know, whether it be, like you said, grief and loss, you know, or addiction or whatever the case may be, you know. But in a word, no, you know, like it's rare that people are that self-aware that they know when they need help. I mean, people know when they need a license or when they need a job, or but like inside help, when they and then asking for it, it's that's one of the, from what I've seen, both in recovery and working for Reentry, that's one of the biggest transformations I've ever seen somebody have, is identifying that they need help and then be willing to accept that help. I mean, it's like setting aside everything that you think you know about yourself and allowing someone else to help you. It's tremendous, and it's paramount to their progress, not just in recovery, but in life itself. And I just want to go on the record as saying, I can't, Dr. Petros Levounis agreed with a point that I made. Like this night is now officially one of my best nights ever. So,
Governor?
I don't know what else to say.
Exactly.
What's the point was, he agreed with it, and that's
Exactly. You hit your high water mark.
Never take that from me.
I'm with you, Robert. Governor, we got a question from the audience asking if we could talk a little bit about agoraphobia and how to get back out there, about how people are intensely afraid about bringing home COVID and how they developed anxiety and fears about contamination and contagion.
Sure. I mean, I want to turn that over to Aakash, but at some point, I also just want to, I remember, Robert, in anticipation for tonight, we talked a little bit about the loneliness of COVID and how that impacts our mental soundness, so I just wanted to touch base on that, but let's just respond to Ralph, thank you, to your question. Aakash, did you want to, Ralph, could you repeat the question?
Absolutely. It was a question about those who have developed agoraphobia with regard to the pandemic, the fear of contracting the virus, passing it on, and how they can get over that and get back out there and start to return to normalcy.
Sure, go ahead, Aakash.
I think one thing I'd bear in mind is that there is no rush or no one way to get back out there, right? If it still feels comfortable for you to keep your mask on when you're outdoors, even though you've been vaccinated, that's okay. I think it's all right if it takes time for you to adjust back into getting out there. I know the CDC has issued guidelines, and that if you've been vaccinated and you're outdoors and you're not going to be particularly close to anyone for an extended period of time, you can take your mask off. That being said, I still see plenty of folks who I know for a fact have been vaccinated keeping it on, because I think it's part and parcel of the adjustment that we're all making. And I think it's absolutely fine for folks to take that at their own pace. And my hope is that in due time, as you're seeing more and more folks go forward with that and not bring home, to lift your phrase, COVID, I think you'll be reassured in following the guidelines as we slowly but surely return to some of the activities that we knew and loved before all of this started.
After Dr. Levounis has impugned his professional credibility and agreed with Carter, I just Petros, so what is it, you read the New York Times and contraction outside, inside, threshold, CDC. I mean, to go to Ralph's question, I mean, I had this conversation with my younger daughter 10 minutes before getting on this call. So
there's a wonderful graphic that the CDC just published with green and red and yellow, the different kind of levels of safety. And then there's a column about if you're vaccinated, and it's all green, maybe with or without a mask, but it's all the way down, even to the most crowded places. So getting vaccinated is absolutely paramount. But apart from that, let's be kind to each other. Each one of us reads the tea leaves a little differently. So being, very adamant about absolutely no mask or absolutely yes mask, I couldn't agree more with Aakash. Then let's just go through this transition process with kindness and love for each other.
No, it's so important. And so I think hopefully we've answered Ralph's question that each individual is unique, that there is not a one size fits all, but people should do what they're comfortable with in the context of what they have done as they reintroduce themselves into the community. Would that be fair, Aakash?
With the exception perhaps of vaccination. Do get vaccinated.
Oh yeah, no, definitely get vaccinated. No, thank you. Thanks,
Yep.
thanks, doctor. Yeah, no, vaccination is,
Yeah.
and it's as an aside though, it's a little bit of a challenge. I mean, in terms of reentry, and I know different communities. I mean, we're about 37 to 40% of our program participants do not want to get vaccinated, and you know, I said somewhat facetiously, we should offer them money, and somebody looked at me aghast. But it's just, it's frustrating because when you look at, to Dr. Levounis said, you look at the numbers, it's incontrovertible that vaccination promotes safety, promotes health. Can you just, before we leave this, how do we make that argument even stronger? Because to go to Mercedes' first question, mental health during the time of COVID, if you're vaccinated, your medical health, your well-being will be enhanced, which should in turn make you have a greater feeling of healthiness.
Every single one of us who has been vaccinated has experienced it, the relief of that burden. You just feel just some kind of load has been lifted off your shoulders. And of course, people who have not been vaccinated cannot really appreciate that effect, but it's just so true.
So there's a psychological benefit.
Oh, immediately you feel happier.
So
You feel you can protect your loved ones. You feel like there's some kind of light at the end of the tunnel.
Lisa, have you seen that at Newbridge at all?
Yes. I mean, I can even speak. I just remember that when I got mine, it was literally like for the day, I just felt like it sounds crazy, but I felt like I was a superhero because I was like, oh my God, I felt better than I did than when I got, when I got to work, I felt overly healthy. So I think that it definitely, I know for like my coworkers and then seeing like, patients, it's definitely a sigh of relief because it's helping everybody get back to the idea of life can start to become normal again, where they feel good.
So Mercedes, like for people in Union City who want to be vaccinated, I know the mayor, I know the school board, Ralph, maybe we can put this, people have an opportunity to know where to go. But if Jim McGreevey's living on Summit and I want to be vaccinated, Mercedes, is there a place to go back to what Dr. Levounis said, that, getting vaccinated increases a sense of well-being? There should be is there a place to go to get vaccinated, Mercedes?
Yes, definitely. You can contact the mayor's office at 201-348-5755, and they will be more than happy to schedule an appointment for you. Also,
the mayor's, I'm sorry to interrupt. So the mayor's office will schedule an individual appointment for vaccination?
Yes, an individual appointment.
And is I'm sorry to say, is it Moderna or is it Johnson & Johnson or what's ever available at the time?
We have Moderna, Pfizer, and we have the Johnson & Johnson too.
Okay.
Due to the issue with the Johnson & Johnson that was put in hold, and now we are using the Moderna and the Pfizer.
Okay. So they can call, and Ralph, maybe you could put that in the chat and put that on the screen so people know that number.
Already done.
Great.
Yes. Also, I would like to mention that we have an additional vaccination clinic at 39 in Kennedy Boulevard, which is the Union City Housing Authority Pavilion. And you can go there Thursday and Friday from 8 a.m. to 4 p.m. And you will have—
It's right at the Housing Authority?
A housing authority,
That's
the
wonderful.
Pavilion Housing. They are providing the Pfizer vaccine on Thursday and Fridays from 8 a.m. to 4 p.m.
That's fantastic. That's great. So that you're like literally right in the Housing Authority, as well as people that can travel to get it. That's tremendous. Yes. And Ralph, thank you. Thanks, Mercedes. So can we, in the time that's allotted, can we just talk a little bit about isolation? One of the saddest things I've seen, Petros, and I know Rob has seen it, and I know Dr. Aakash is our medical director, is persons that have died alone. And it's mental health and it's addiction. It's people coming out of prison. They've been put into a single room occupancy, or they're in a hotel room with a flat screen TV. They don't have any human interaction. They don't have Mercedes telling them where to go for their vaccine. They don't have Rob talking about AA. They don't have Petros talking about, and Aakash talking about rhythms and kindness and love. And they're in a room, and literally this is a family audience, they get a case of the blankets. So what do you do about that acute loneliness, Petros? Is there a way during COVID, I mean, that you can reignite the value, the preciousness of life? I mean, for us, it's always about service. And we always believe serving another person. I mean, from my days up in Harlem on, serving another person, whether it's a soup kitchen or in a food distribution, and Union City does so much good. Is there a way to get out of that dank, lonely, isolated place?
Well, you said it right. It's trying to find a sense of purpose again, whether it is giving to other human beings or creating for people who are more artistically inclined. Whatever it is your field, to get back to feeling that you have some kind of reason of being in this world. And some of that can be done virtually. I know all of us are sick and tired of Zooms and WebExes and virtual weddings and virtual funerals and virtual this and virtual that, but they're better than nothing. They really are, and probably more than just better than nothing. For example, recovery groups on the internet, they have tons to offer. They may not be exactly the same as an AA meeting, which is in person, where you can just hold hands, you can just see each other. But these virtual recovery groups have done tremendous job for a lot of people. So don't put the idea of virtual connection. Try to work with it the best you can.
So virtual connection is important. Aakash? Battling
I would say it
loneliness.
goes back, yeah.
The loneliness factor,
I think
the isolation, the thinking that I'm all by myself in this world and I don't have these connections.
Yeah, I think at the very least, it starts by saying something. So reaching out to whoever it is you do interact with, whether it's a friend, a family member, a neighbor, and simply speaking up and voicing what you're feeling is, I think, an essential first step. It, of course, requires self-awareness, a level of insight that is difficult to come across when you're feeling as lonely as so many do during this time. But at the very least, I'd say if you're feeling that way, start talking about it. And I think one of the not quite pleasant but not unpleasant surprises will be that you're not alone. And I think in that
being alone and being alone.
Yeah.
Rob?
I would just, if I could just modify a little bit something that Aakash just said, which I think it's early on. You don't have to talk about your loneliness. You don't have to talk about your depression. You don't have to talk about your discomfort, as long as you talk. So if you find somebody very much like Aakash said, a neighbor or a friend or a loved one, and you can talk about sports or politics or whatever it is, but as long as you talk to somebody, because some people feel that it's too much to even start addressing their loneliness or their distress.
Thank you. I think I led him down that path of talking about your loneliness, but I thank you. Just talking, communicating. Rob?
Yeah, so Dr. Levounis, that's exactly what I was going to say. He
Oh, so wait, so now you're validating Dr. Levounis. Okay.
That's right.
This is
I had to return the favor. It's the least I could do,
Exactly. You're the last 5 minutes you're saying, Dr. Levounis, you're great. Good, Rob.
No, but I mean, so like I'll speak to how it was, how it is in the rooms, because work got me through, you know, the pandemic for sure. Working 7 days a week for you is always a blessing. But, you know, especially during the pandemic, just kept me, you know, kept me focused. But like, so guys that'll come in and out of the rooms, a lot of times, like I'll just call them and just talk about me and let them listen. You know what I'm saying? Like, I don't even ask them to talk about what's going on with them. You know, like the identification piece, you know, just reaching out and then just listening to like someone else talk about whatever it is. And that, like, I mean, that's it. You don't have to call somebody up and tell them everything that's going on with your loneliness and your depression. Like, it's it. You can talk about anything. You can talk about like sports or the weather or what you can't wait to do or whatever. It's just, it's that one little spark that gets you that much closer back to some type of normalcy, you know, and that's the difference, you know, just any type of contact with anyone else, as small as it could possibly be, could spark it and turn that loneliness around, you know, and like it hits close to home. You know, my brother has been dealing with that, you know, and during the pandemic, it really affected him a lot. And, you know, it's difficult, even when it comes to family members, you know, you know, you think you could do everything for them, you could save them, but like it's up to that individual to reach out for help or not reach out for help. And many times I would just call my brother and talk about work, complain about gym, you know, do whatever, you know, like just that contact, letting him know, like, you know, like I love him and that, you know, like he's important to me, you know. And eventually, you know, he started calling me and talking to me, you know. He did a bunch of years in prison and he's not really an open person, but, you know, it's been that way for me with both family and people in recovery and people in reentry, people that I met, you know, in and out of the reentry program, because we stayed open the entire time virtually. You know, we had clients every single week, you know, last year, and you know, we had the opportunity to stay in contact with them, and that's all that it was. You know, it was just that contact, whether it be virtual or in person or text message or phone calls, you know, and Zoom, and it just makes all the difference. You know, at least that's what I'm told.
Thank you, Rob. And Lise, you'll be able to share the information for Newbridge both on the chat and on the website, so that people can contact either Rob or Lisa at Newbridge directly.
Absolutely. Yep. I already put it out for Ralph, and anything that you guys need. If you can't get myself, Rob, we're here.
Great. And Ralph, in terms of communicating, you'll be able to communicate these referral sources through the website, through the Board of Education.
Absolutely.
And Mercedes, you'll also make sure that we put the, to go back to what Petros said earlier about the testing is, and where this testing is available. And I love the fact that it's in public housing, because so much of the challenge of this pandemic is to make sure that those without means have access. So we're about to wrap up. The first thing I want to say is thank you to Mercedes for being the driving force. A round of applause for Mercedes. Thank you, Mercedes, for making this happen. I'm going to say thanks, Ralph, for publicizing, Lisa, for everything you're doing, Aakash, for being the steward of New Jersey Reentry's medical director and connecting or peer recovery, OBGYN, all the services, Rob, for everything you do, and Dr. Levounis, really for hitting a high note professionally. That Rob Carter said you were right. And last comments, I'll give it to Aakash and to Petros. Petros, you know, we started mental health in the time for COVID. We talked about depression. We talked about anxiety. We talked about addiction. I walk away with a sense of being aware that you're in the space, just being able to talk about it, and then to go to use Aakash's, you know, the rhythms, and understanding that those rhythms are short-circuited, do something similar, whether it's the walk in the park or try to recapture that. So what I talk about is awareness, that acknowledge that you are in this place, and just talk to somebody and recapture that. But last 2 words, Dr. Levounis.
Beautifully summarized, Jim. Thanks so much. Just a shout out for pets. Pets have a great place in our lives, and even if you cannot really find somebody that you can talk with so much, you know, think about perhaps having a pet in your life. That may make a big difference.
That's great. And if anybody wants, I have 2 cats that I'm ready to give tomorrow that are my daughters, that I wind up cleaning, feeding, and changing the kitty litter. Aakash.
No, I just want
Pets
to
are
express
great.
I just want to express my gratitude. I think your summary was spot on, and I'm just grateful to Mercedes, to Ralph, to Lisa, Petros, Rob, for all that they do. And for me, I think the big take home is that we're all in this together, and so not all of our journeys will be the same, but we're all journeying together. So I hope folks that are listening know that they're not alone. This is a difficult time, but it will get better.
Thank you. On behalf of the Union City Board of Education and Mercedes Joaquin, on behalf of Ralph and Lisa and Dr. Levounis and Rob Carter and Dr. Shah, I just want to say thank you, and particularly to Mercedes and the Board of Education. And understand, as you people challenge to be aware, to share, as I think what Dr. Levounis said, is simply to love and to understand the importance of communicating and sharing. And so on behalf of all of us, I just want to say thank you for listening, for watching, and for sharing. Godspeed. Thank you.
Thank you.
Thank you.
Thank
So
you.
much. And
Thank you,
Thank
Governor.
Thank you, everyone.
Thank you, everyone. Thank you, everyone.
Thank you.
We got a lot of compliments on that panel.
Thank you.
you.
I know Dr. Levounis feels so much better now.
yes,
Thank you to all our panelists. I want to say thank you. Your information is very much appreciated. And Ralph and myself, we will pass in your contact number for our school community. And I also want to thank two other people attending this seminar. And please know that you are not alone. Again, we are here to help you to go through the end of the tunnel. There is light at the end of the tunnel, and we're going to be with you all the way on the road. Please stay safe and stay well. Thank you.
Gracias.
Good night.
thank you.
Good night.
Bye.
Thanks, Mercedes. God bless. Thanks, everyone. Thank you. Thank you for your time. Thank you.
Thank you.